Okay, so picture this. In hospitals all over the world, there's a new team member making the rounds. It's one that never sleeps, never gets tired, and can see things the human eye might completely miss. Today, we're going to meet the AI agent.
So, here's the thing. In medicine today, we're just drowning in data. I mean, every single day, our hospitals are churning out a mind-boggling amount of visual data from MRIs, CT scans, and X-rays. And the problem? We have way more images than we have qualified radiologists to actually interpret them.
And you know, this data overload isn't just some abstract problem, some logistical headache. It has real, serious consequences for patients. It creates these massive bottlenecks that lead to diagnostic delays. It contributes to burnout for our incredibly dedicated radiologists, and sometimes it can even lead to fatigue-related human errors. That's the core challenge we're facing. So, what if? What if we could give our medical professionals a partner that was tireless, a partner that could process millions of data points in a split second and help them spot details that are nearly invisible to the human eye?
All right, so what does this partner actually look like? Well, this isn't just another app on a phone or some simple piece of software. We're talking about a fundamentally new kind of AI, the AI agent.
Now, to really get what makes an AI agent so special, we've got to draw a clear line in the sand. We're all pretty familiar with AI assistants by now. Think of a chatbot. They're reactive. You give them a command, they do a single thing. An AI agent, though, that's a whole other ballgame. It's autonomous. It doesn't just follow one simple command. It manages complex, multi-step workflows, it makes decisions, and it actually learns from experience.
Okay, so how does this autonomous agent actually, well, think? How does it approach a really complex problem, like a medical diagnosis?
Probably the easiest way to wrap your head around it is to imagine a specialized medical team, but one that lives inside the machine. It's not just one single giant program doing everything. No, it's a collaboration between different specialized roles, just like a team of doctors would consult on a really tough case.
It all kicks off with the planner. You can think of this one as the lead consultant, the one in charge. When a complex medical scan comes in, it doesn't just jump to conclusions. It methodically breaks the entire problem down into logical steps. It creates the whole game plan.
So once that plan is set, the decision maker steps in to execute it. For every single step of that plan, it asks, okay, what's the right tool for this job? It might need an algorithm that can precisely measure a tumor, or maybe it needs to pull up a patient's entire history of previous scans for comparison. It picks the right tool for the moment.
And finally, you have the advisor. This role takes all of that detailed analysis and synthesizes it. It pieces all the findings together to form one single, coherent diagnostic insight, a clear recommendation that a human doctor can actually understand and act on.
That's a great structure, right? It makes sense. But hang on a second. Medicine is constantly evolving. I mean, new research is published literally every single day. So how on earth does an AI agent stay current?
The secret is a really brilliant technique that you can think of like a superpowered library card for the AI. Before it even offers a diagnosis, the agent can instantly consult the entire world's library of the latest medical journals and clinical trials. This makes sure its insights are always based on the most up-to-date science. The technical name for this is Retrieval Augmented Generation, or just RAG.
But you know, having access to all the data in the world is only half the battle. The real breakthrough, the magic, happens when the AI can learn from the most valuable source of information there is, the nuanced, hard-won experience of human doctors.
This is done through a process called reinforcement learning from human feedback, or RLHF. And this isn't about just teaching the AI to find the right answer. It's about teaching it to think like a doctor, to align its own reasoning with the values and priorities of a human expert. It's how the AI learns not just what to see, but how to see it.
So here's how that learning loop actually works in practice. First, the AI agent might analyze the scan and suggest a few possible interpretations. Next, a human radiologist reviews those options and gives feedback, and not just saying which is correct, but which is more clinically useful or which line of reasoning is the most sound. And then, the agent takes that feedback and updates its own model, literally learning to prioritize the kind of nuanced thinking that makes a human expert so valuable.
So when you put all of this together, the autonomous agent, the constant learning, this feedback loop with human experts, what does the future of diagnosis actually look like for doctors and for patients? The potential impact here is just enormous. Remember those problems of radiologist shortages and burnout we started with? These agents can provide expert-level support in rural and underserved areas and dramatically reduce workloads and delays everywhere. On a clinical level, they can spot subtle, early-stage conditions that are incredibly difficult for the human eye to catch, and then tirelessly monitor a patient's progress over time, tracking even the tiniest changes.
And it is so crucial to understand that the goal here is absolutely not about replacing doctors. It's about empowering them. It's about giving them an incredibly powerful partner to handle that data overload, which frees them up to focus on what they do best, caring for their patients.
And this leaves us with a really profound question for the future. As AI becomes a true member of the medical team, collaborating with and learning from human doctors, how will our very definition of medical expertise begin to change? It's a future that's arriving a lot faster than we think.